I'm German, and I was born in Germany, and I grew up in Germany. And German is also my first language. So I learned English in school much later. And it was only when I was 18 that I came to Nigeria for the first time by myself. But it was an immediate love story, because my experience of Nigeria was one that I didn't have in Germany, unfortunately. So while I also get here where you're from, or Oibo, or, what did you bring me? It's also always one of welcome back, welcome home. And that's something that I never have in Germany or in the UK. There it was always more of a story of where you're from, but where you're really from, but really, really. Nigeria became home, and it became the destination for me of all my holidays. That was through university and even afterwards. Christmas, going to the village was always a pleasure for me, being surrounded by my people. So I did my A-levels in Germany, and then I started traveling around the world and became fascinated what makes people do what they do, behave how they behave. So I went to the UK and I studied psychology as an undergraduate, then became even more fascinated with the brain. So I did a master's in neuropsychology and worked in Oxford for a while in neuropsychology and neurosurgery, actually. And then I did a doctorate in London in clinical psychology and specialized in addictions and trauma psychology. But I'm saying that not so much because I think this is so great, but just to give you a brief history of my story. And point out that while I was doing my doctorate in London, I looked at social support as a potential way of mediating against some of the risk factors that we know that lead to mental health. I'm not going to go too much into that, but all I want to say with that really is that while I was studying how, supporting each other socially could help us from becoming ill, mentally ill, I realized that I had literally no social support back in the UK, with all my family being here in Nigeria. And what possible impact that might have on my own health and mental health. So my motivations to move to Nigeria were a lot personally of what I've just said, but also a mix, personal and professional. Because while working in London, and I was working in addictions, and I was, becoming a specialist in mental health there as well, was very rewarding. I think, mental health is a very neglected area in Nigeria with a lot of opportunity and a lot of need. And it was really that need and that opportunity that really attracted me to come back and to start doing this here. Saying that it's a very niche area that comes with its unique challenges. Not at least that a lot of people here don't actually know what mental health is, or that we have mental health, that is part of health, and then the stigma surrounded to it. Mental health is usually seen as mental ill health, and as dangerous, and as violent. So that prevents people from accessing care and from receiving proper care. But it's also interesting because it reflects in the conversations I have with people when I meet them at gatherings like this and point out that I'm a clinical psychologist, and you start noticing people slowly moving away from you because they think you start reading their mind, or you're crazy yourself. But yeah, so there's a lot of stigma. One of the big challenges that I faced moving back and trying to, establish working within a mental health care system that is non-existing. Related to that is this country doesn't actually have a mental health act. So, the legislation and the government insurance for what we should be doing with people who have mental illness. This doesn't exist. So pretty much anyone can do whatever they want at the moment. And then we don't have enough clinical psychologists or psychiatrists. So for me, that means that work becomes much more dangerous, but it also becomes much more isolated. So one of the first messages that I would want to give anyone who is either here and not sure what they're studying or abroad and is studying in the mental health field, we need you. We really do. There's a lot of work to be done, and it is about, coming back and connecting and doing it. But apart from the challenges, and I think that was also pointed out already, is the great opportunities. So the need is one, but the opportunities. I've been here now for 2.5 years, and I have been able to do these conferences, do interviews on radios. I've done a TED Talk myself. All really valuable experiences that I believe I wouldn't have been able to do over the last 2 years in the UK or Germany or anywhere else in the world. And opportunities that I'm really grateful for. And it's also it's also let me make really valuable connections, like connections with the Nigerian Health Watch, and I think that is what it's all about. At the moment, I am working with a lot of different organizations. So I have a private practice in Lagos, but I also provide online therapy so that I can reach a wider audience all over Nigeria. I work with international NGOs such as MSF, Doctors Without Borders. I work with schools. I work with companies. I work with local NGOs to try and start writing a mental health bill. So while I might not have a hospital yet, or even a big business, for me it's all about making these relationships and finding your feet, but also making an impact, a wide impact, in as many places as you can. That's been really valuable for me. And in saying that, I think that's also what I think the future of health in Nigeria and globally should be about. Not so much just about one approach. So when I think of the brain gain of the Diaspora for Nigeria, I think that should be a reciprocal relationship. It shouldn't just be people returning and giving back. For me, it has been also about gaining a lot from Nigeria, and I think that's what it should be about, a both-end approach of people moving back and people gaining, and us together forming a global network of actually creating innovative solutions to problems here that are meaningful here, but also worldwide. So at the moment, for example, online therapy, that is something that is globally exploding. But I'm also working with the UK together to, for example, create tablet-based therapies that will be valuable here in not so urbanized settings, but also, again, helpful for Nigerians that live in the UK that might be able to benefit from exactly that therapy there. Another thing that I think is important and that I think was important for me and that I would like to send you away with is the fact that when I was asked what would I say anyone could do to motivate young people or people to come back to this country, and I think for me it is about welcoming people back home again, making this place home again, and thinking of Nigeria as home. Because unless we start treating each other with care again and caring about each other, which will include financial investment, practical investment, I don't think anyone would want to be here. I think for me, the selling point, and for many young people, it is about feeling cared for, having a place of belonging. And finally, I think it is, and especially in the health sector maybe, it's thinking about young people. A lot of times we have an approach here of thinking age is wisdom, and I agree with that, but I think youth is wisdom too. And there's a lot of young potential both in this country and in the diaspora. And within the health sector, we have this idea of no offense, but the old professor with the glasses. And that might be true, but I think, especially also with technical solutions, social networking becoming much, much more important in this country and globally. It's about engaging with our young people, listening to them, motivating them, and integrating them into the solutions for health, mental health, and any other sector in Nigeria. So that's my story. Thank you.